Hi, Dr. Angela and Dr. Anastasia here. Today, we're here to talk about frequently asked questions that we get, now that you're part of our care here at Sage Clinic. So one of the first ones that we hear a lot or get asked a lot is, can you be my primary care provider?
And that is an easy one. That is yes. Yeah. So as naturopathic physicians, we are licensed as primary care providers in the state of Washington. Mm-hmm. That means we can do most of the things that your primary care provider any primary care provider can do. So
right. So we can, prescribe the medications that you need. Pretty much we can prescribe everything except for maybe high-end narcotics. We don't do that, but it's a discussion certainly that we can have, so for people managing hormones, prescribing an antibiotic when it's needed, all of those things we can do.
Which also means we wanted to encourage you to think of us when you have an acute concern. A lot of times we see our patients for lots of ongoing chronic conditions, and then they tell us when they had something acute come up, they ran over to urgent care, but actually instead of going to urgent care, you can come to us. Give us a call. We can often get you in the same day if it's an acute concern, a cold, flu.
Yeah, urinary tract infection.
Those type of things that come up.
Yeah.
We can help you with that.
Right. And on the flip side, many times people also don't think of us for like their annual exam. So for women having your Pap done and your annual breast exam, we can absolutely do that and then bill your insurance as if you're going to a walk-in or an Everett clinic or something like that.
And then we can also do referrals to specialists or order your annual or various screening exams, such as colonoscopies, mammograms, as was mentioned, different things like that. So,
right. Yep. And then we also get asked, say if you are my primary care, I was also looking for, functional medicine. Can you do that as well? Because that is becoming a popular term out there for doctors who practice a more holistic, integrative type of medicine.
Yeah, and something that's a little different between a conventional primary care provider and the type of primary care that we provide is that we look at it from a functional perspective. So we are always going to look at you as a whole person, not a separate organ system. So if something comes up, we will really review comprehensively your labs as well as your symptoms and really look at how we can support you as a whole person instead of just trying to target isolated symptoms or conditions.
And one thing that we both are super excited to offer is that, at our clinic we spend extra time with you, and we really do, we go the extra mile to really look at, we try to see things on many different levels, and a lot of times that's through interviewing you or doing additional lab testing or doing specialty testing, which we'd like to get into in our next video that will be coming.
Yep, so stay tuned for that.
So thank you for joining us, and we look forward to seeing you soon.
See you next time.